So, good evening, students. We'll be starting with a new series, that is the series of surgery lectures. I'll be attempting to cover each module of a chapter on a weekly basis. So now in the CBME format, that is the competency based medical education format of teaching, each chapter of every subject is divided into different modules, and these modules are aimed at developing competency rather than just promoting um, the memorization of facts without understanding them. So the first chapter in surgery is basic principles of surgery, and the first module here is uh, describe basic concepts of homeostasis. uh, this may also come as a question, as a direct 10-mark question for you, uh, in the form of describe basic concepts of homeostasis and describe or enumerate metabolic changes in injury and their mediators. So it can be discussed. They may ask you to describe or they may ask you to enumerate. So this basically has two parts. That is, first you have to describe the basic concepts of homeostasis. That is, what are the concepts which are present in the process of homeostasis itself. Then you have to discuss about or enumerate the metabolic changes in injury and their mediators. So metabolic changes and mediators, both you have to enumerate. If they ask you to enumerate, you enumerate. If they ask you to describe, you describe. You enumerate, then you describe. Okay, moving on. So basic concepts of homeostasis. So what is the definition of homeostasis? Homeostasis refers to the ability of our body to maintain a constant stable internal environment. So the physiological mechanisms that are going on in our body require a certain temperature, require a certain pH for the enzymatic activity, for the hormonal activity to go through. So the basic concepts of homeostasis refers to the ability of our own body to maintain those physiological constraints, physiological environment, internal environment, in a stable format. Okay, now it has four components. These four components can be elaborated as a closed loop or a open loop system. Now the four components are, first is the sensor which is present over the organ. Okay, these sensors are thermomechaноreceptors, that is, they respond or they sense the mechanical duress or the thermal duress. That is, if there is a fever, if there is hypothermia, the thermal sensors come into play. If there is decreased BP, hypovolemia or hypertension or edema, then the mechanical receptors, they come into play. Now these sensors, they sense the deviation in the homeostasis, and they convey it to the control center, that is the respiratory center or the renin-angiotensin system. From there, the control center sends stimulus to the effector for up regulation or down regulation of the systems, such as if there is hypovolemia, then there will be up regulation of the blood pressure. If there is hypertension, then there will be down regulation of the cardiac output. Then this effector sends a correction factor, that is, sends a stimulus. This corrects or rectifies the imbalance. This correction factor goes and acts on the organ itself. So this is a closed loop. Okay, there are no open ends, as you can see, right? So next is the open loop system. In the open loop system, everything remains the same except that the sepsis or trauma is the stimulus for organ distress, okay, for metabolic distress. So this organ again sends the sensor, senses the distress, gives the sensation or the sends the stimulus to the signal to the control center. Control center again stimulates the effector again stimulates the organ. But here, apart from just the body which is handling the pressure, we have surgical and medical interventions, such as if there is hypovolemia, we give fluids. If there is hypertension, we give medications to reduce the blood pressure such as vasodilators, and we give beta blockers to reduce the heart rate. So these are surgical and medical interventions. For example, if there is a hematoma, if there is a vascular breach, then we go in and rectify it surgically. So these interventions, they also help in, they act in tandem with the effector signals on the organ. So what do? They reduce the perioperative stress and they reduce the load on the homeostatic mechanisms themselves, so the loop can function efficiently. Here we call this an open loop because here we are giving we are doing extra interventions which can affect the output of the organ itself. So this may or may not progress in the towards the sensor after getting corrected. So this is basically a open loop, right? So this is how you have to start your answer. You have to first give the definition of homeostasis, and you can write these two diagrams, that is closed loop system and the open loop system. These are the basic concepts of homeostasis, no more, no less. Next we come to the second part, that is metabolic changes in injury or trauma, and enumerating the mediators. Okay, when you have to enumerate, you just enumerate. You don't have to describe each factors and each mediators, the role of each mediators, the happenings of each metabolic changes, how they occur, what happens when they occur. You don't have to describe everything. You just have to enumerate. Usually when the question is asked for enumeration, they have a third part. Which may ask you to describe the metabolic changes, or they may ask you to describe any neurohormonal responses in the metabolic changes of the injury. But here we are covering enumeration and discussion of metabolic changes. So enumeration there are three things you have to enumerate. First is phases of metabolic changes. Second is metabolic changes themselves. Third is the mediators and accelerators. So first is the phases of metabolic changes. So there are three phases. First is the ebb phase. Second is the flow phase or catabolic phase. Third is the recovery phase or the anabolic phase. Okay. Then second, coming to metabolic changes themselves. First is the lipid metabolism, that is lipolysis. Second is proteolysis, that is protein catabolism. Third is carbohydrate metabolism or glucose transport, uptake and utilization. The fourth is insulin release and insulin resistance. The third is mediators and accelerators. So mediators are different, accelerators are different. First, coming to the accelerators, these hormones such as adrenocorticotropic hormone, cortisol, catecholamines, glucagon, IGF-1, testosterone and T3. These are accelerators of metabolism or metabolic changes. Okay, some of them cause catabolism, glucagon, ACTH, cortisol, catecholamines and glucagon cause catabolism, and IGF-1, that's insulin-like growth hormone, IGF-1, testosterone and T3, they are anabolic hormones. And mediators, coming to mediators are cytokines which are interleukin 1, 6, 8, TNF alpha and interleukin 10. Although these interleukin 1, 6, 8 and TNF alpha are pro-inflammatory and interleukin 10 is counter-inflammatory. Second of the mediators are the lymphocytes themselves, that is polymorph nuclear neutrophils, macrophages, fibroblasts, etc. Right. So when you see the question as enumerate, you have to enumerate of all the three components, that is the phases of metabolic changes themselves, and the mediators and accelerators. This is how you have to write. If you want, you can draw this diagram or you can let it be. So this is the ebb phase, that is will come in the next page. We'll discuss ebb and flow phase in the next page. So when the question is asked to describe the metabolic changes, you have already enumerated here. Now you start describing one by one. Okay. Ebb phase is a phase of decreased metabolic rate. That is, everything is decreased, everything slows down. Okay, this is a phase of early shock. Onset is immediately after trauma and it lasts for about 24 to 48 hours. What is the aim of this phase? The body tries to conserve the energy stores so as to redirect its resources towards the part which is under stress, or the towards the part which is injured, so as to uh, protect it, and so as to redirect the immune system for its protection. Now, what are the features? There is reduced cardiac output. This reduced cardiac output causes hypovolemia. It also causes hypothermia and causes low basal metabolic rate and lactic acidosis. Since there is reduced cardiac output, there is decreased oxygenation, and decreased oxygenation promotes anaerobic metabolism, and lactic acidosis is the result of anaerobic metabolism. That is, pyruvate is converted to lactic acid in anaerobic metabolism. Now, what are the mediators of this phase? Because this is an early phase which decreases everything, this is mediated by catecholamines, cortisol, aldosterone. These are all stress hormones. These hormones, they try to reduce the stress on your body. Okay, so this is the ebb phase. Okay, these 5 points are enough. Now coming to the flow phase, right? The flow phase is a catabolic phase. Okay, catabolic means there is energy expenditure, there is breakdown of proteins, lipids, and conversion of those products into glucose so as to utilize that glucose. Okay, it lasts for 3 to 10 days for uncomplicated elective surgeries, and may last for weeks for complicated major surgeries, because complicated major surgeries require a lot of energy for recovery. Therefore, this phase may last longer in them. So the aim is to mobilize the body energy stores for recovery and repair. Here in the ebb phase, we were conserving the body energy stores. Why were we conserving? It is for mobilizing the body energy stores for recovery and repair. Now, what are the features? Here in the ebb phase, we had low BMR. Here there is high BMR. So it is opposite to the ebb phase. Everything here is in opposition to the ebb phase. High BMR, that is this protein breakdown from the muscle, and there is fat reduction. There is increased cardiac output. There is hyperthermia, may be indicated by fever. There is tissue edema because there is capillary leakage. Then there is leukocytosis because the cytokines and the chemokines, they cause migration of the leukocytes from the blood vessels into the peripheries. Also, there is increased oxygen consumption for glucose oxidation and ATP formation. Now, ATP formation in aerobic metabolism, 2 ATPs are formed. In anaerobic, where pyruvate is converted to lactic acid, net minus 4 ATP are lost. That is, 2 ATP are gained in aerobic and 4 ATP are lost in anaerobic. And there is increased gluconeogenesis. Gluconeogenesis is the process of formation of glucose from fat and from fat and proteins. Okay. Now, what are the mediators of flow phase? Adrenaline is the main hormone. Okay. Then next, all the other hormones which I mentioned earlier: glucagon, ACTH, catecholamines, corticosteroids, cytokines, and oxygen free radicals. All these are mediators of the flow phase. Right. Now coming to the metabolic changes themselves, there is a recovery phase. We will discuss about the recovery phase at the end because it is an anabolic phase, and now because we have started the ebb phase, which is conservation stage, and we have started with the flow phase, which is a catabolic phase. So we'll continue the catabolism and discuss about the metabolic changes that occur in catabolism itself. So lipid metabolism, there is lipolysis, that is triglycerides are converted into fatty acids and glycerols. Fatty acids are converted into acetyl CoA via Krebs cycle, where ketones are formed. Okay. So the mediators here are ACTH, cortisol, catecholamines, and glucagon. This is all you have to write for lipid metabolism, that is for metabolic change. Right. Here there is a small note which you may want to remember, but not necessary to write in the exam. The main labile energy reserve, labile means available, readily available, energy source reserve is fat, and main labile protein reserve is skeletal muscle. What does labile mean? Labile means it is readily available. Whenever there is need, fat readily is utilized. It is readily utilized as an energy reserve, and protein reserve in skeletal muscle is readily utilized. Okay, if you want proteins in emergency situations, skeletal muscle protein is readily utilized. If you want fat, or if you want energy for that matter, in emergency situations, fat is immediately used. So coming to the second metabolic change is the protein metabolism. Now skeletal muscle is the main source of protein. Okay, gluconeogenesis, there is protein catabolism which generate amino acids. Amino acids are required for the synthesis of acute phase proteins, that is albumin, fibrinogen, glycoproteins, complement factors, C-reactive protein, ceruloplasmin. These are all acute phase proteins. Okay, these proteins help in either transportation of complement factors, either transportation of the leukocytes, either formation of leukocytes, formation of macrophages, formation of immunoglobulins, right? So proteins are basically the raw material through which our immune system is formed. Okay, and in cases of emergency, the proteins are utilized to form more and more parts of the immune system. Okay, now main amino acids produced are glutamine, arginine and alanine. Alanine is produced from the muscle, glutamine and arginine from the liver. So there is a net, because this is a catabolic phase and this protein catabolism, in protein catabolism the net nitrogen loss is up to 20 gram per day, and a loss of 40% of or more proteins may lead to the death of the patient. So this is protein metabolism, that is changes in protein metabolism. Instead of protein buildup occurring, instead of amino acids being converted and stored inside the muscle and the liver, they are broken down. The proteins in the muscle are broken down into amino acids. In the muscle and liver are broken down into amino acids, and they are converted into acute phase proteins. So we covered two metabolic changes, that is lipid metabolism and protein metabolism. Now this is just for your knowledge. There is I call it the circle of death. It's not given in the book like that. But what happens is the liver is the main source of albumin. Okay, the liver albumin is the export protein of the liver. So liver provides albumin for flow phase, that is for catabolism, and albumin is utilized in different stages of the inflammation. But the cytokines, that is the pro-inflammatory cytokines, cause transcapillary leakage of, because there is capillary leakage, albumin also passes through the transcapillary leakage, and this results in hypoproteinemia or hypoalbuminemia, which again stimulates the liver to produce more albumin. So there is stress over the liver to produce albumin. The albumin is getting lost, and there is again hypoalbuminemia, which is again triggering the liver, which is increasing the stress on the liver. Here we are also losing albumin because of increased inflammation or prolonged inflammation. So prolonged inflammation, because the transcapillary leakage due to pro-inflammatory mediators, it allows the migration of leukocytes and macrophages to the injured site, and leakage causes initial fluid load and edema. So this is the initial mechanism. Here, because of loss of albumin and increased stress on liver, there may be temporary liver failure in the flow phase, for which we have to watch out. Okay, so here instead of putting all the pressure on the liver, as we had talked about the surgical interventions and medical interventions to decrease the stress on body homeostatic mechanism, this is where we can give external albumin. We can give external albumin to decrease the load on the liver, and we can regulate the capillary leakage by giving some vasoconstrictors or increasing the oncotic pressure of the plasma itself, so that the leakage decreases, right? So next is carbohydrate metabolism. Carbohydrate metabolism, there is not much to discuss. As there is gluconeogenesis, there are major changes in the lipid and protein metabolisms which lead to formation of glucose. So proteins lead to formation of glucose, and they are required by the brain for energy purposes. Brain requires 100 grams of glucose every day for its use. Next, it is also used by leukocytes, macrophages, immune cells, fibroblasts and granulation tissue for energy expenditure. So all this catabolism is to produce glucose. So how we can limit the catabolism? We can do administration of glucose plus insulin, which may slow down protein catabolism, protein breakdown, and reduce ketosis. There is release of glucocorticoids, and insulin resistance also occurs, which causes hyperglycemia. So we can do something about this. We'll discuss in the next this point. So insulin and insulin resistance. Insulin is an anabolic hormone, that is, it promotes growth, it promotes storage. Here, okay, insulin, it blocks lipolysis, increases or promotes protein buildup, and it promotes uptake and storage of glucose by GLUT4. That is, GLUT4 is a glucose transporter. Okay. It promotes storage of glucose in the liver as glycogen, the muscle as glycogen, in the fat as triglycerides, right? So these pro-inflammatory cytokines, which are released after the ebb phase under the influence of hormones, they block the insulin and promote insulin resistance, so that insulin does not cause this, because lipolysis and proteolysis is required to form glucose for the metabolic homeostatic mechanisms, right? Because the energy is being redirected. So pro-inflammatory cytokines block the insulin, promote catabolism. Insulin is an anabolic hormone which is mainly useful in the recovery phase. So what happens when the insulin is blocked? It promotes insulin resistance and causes hyperglycemia, right? So when there is hyperglycemia in a patient, it usually means that there is insulin resistance and the insulin is being blocked, and there is extra, or the pro-inflammatory cytokines or the pro-inflammatory mediators or factors are taking over. Okay, increased duration of hyperglycemia is detrimental to the health of the patient, so we have to maintain a euglycemic state. So here we can start an insulin infusion which can inhibit hyperglycemia and promote anabolism, right? This anabolism, we have to maintain a balance between the catabolism and anabolism, because if there is only catabolism, like we discussed, if the patient loses more than 40% of the proteins, then the death of the patient is more and more likely, right? So the last, because we have finished all the catabolism, we have moved to everything is over, the catabolic state is done, inflammatory mediators have backed out, the injury is healing. Now there is need for anabolism or recovery phase. Patient enters the recovery phase. It may take from few weeks to months. It also known as convalescence phase. There is restoration of proteins, fat stores, and there is normalization of positive nitrogen balance. Positive nitrogen balance can be achieved up to 4 gram per day, may be up to a maximum of 25 gram per day, and may also increase in rapidly increasing positive protein balances to up to 100 grams per day in rapidly recovering individuals, or individuals, young individuals who had good muscle mass before the injury or stress. So what are the hormones here? Insulin, testosterone, and T3 hormone. These are the hormones which are related to the anabolic phase. Okay, so recap. When you get a question, describe the basic concepts of homeostasis and enumerate or describe or discuss the metabolic changes in injury and their mediators. This is what you do. Write the basic concepts, define, mention the closed loop system, open loop system. These are the basic concepts of homeostasis in brief. Then a metabolic changes. Enumeration involves mentioning the phases of metabolic changes themselves, mediators and accelerators, enumeration of these. Okay, this is just enumeration. Next, if you want to describe, After enumeration, start describing the ebb phase, the flow phase, then discuss the metabolic changes, that is lipid metabolism, protein metabolism. This is just for your knowledge. If you want, you can write the exam. This is carbohydrate metabolism, and this is insulin and insulin resistance, insulin production, insulin resistance. So this is a small diagram showing how insulin promotes and how insulin is inhibited, and what are the drawbacks of insulin production and drawbacks of insulin resistance, and what are the advantages. Next, after everything is done, we come to the recovery phase, that is anabolic phase. So this is how you write a question. So this is how you answer this question. Please like, share and subscribe. Share this video if it is helpful. Let me know how we can improve the lectures, and see you next time, see you next week with a new module. Thank you so much.